Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the fifth anatomy lecture of this block. So bismillah, let's start. In this lecture we're going to talk about the blood supply of the head and neck. So since we're talking about the blood supply, we're going to talk about arteries and veins. So the first part of the lecture is going to be about the arteries, and then we're going to move to the veins. So before we start, let's see an overview of the arteries, okay? So we're going to talk about the common carotid arteries and the subclavian arteries. And we're going to see their divisions and all the details, tamam? So, starting off here with the arch of the aorta. So let's see the origin for these arteries. Where do they come from? So here we have the arch of the aorta. We need to focus on the right and the left. We need to differentiate between them, okay? Because there are slight differences. So focus, and this is the right side and this is the left side, okay? So we have the arch of the aorta. The first branch we're going to get from the left side is going to be the left subclavian artery. So we're going to have the left subclavian artery, and we're going to have the left common carotid artery. Tamam? What's the origin for these two, the left subclavian and left common carotid? It's going to be the arch of the aorta, because they directly branch out from the arch of the aorta. Tamam? Now let's see the common carotid and the subclavian arteries on the right side, okay? Let's see the right side. For the right side, we have the arch of the aorta, same thing here. But then we have a trunk known as the brachiocephalic trunk. This brachiocephalic trunk then branches and gives us the right subclavian and the right common carotid. So the origin for the right common carotid artery and the right subclavian artery is not the arch of the aorta, it's the brachiocephalic trunk. Tamam? The origin for the right common carotid and right subclavian is the brachiocephalic trunk. The origin for the left common carotid and the left subclavian is the arch of the aorta. Tamam? Tamam. Now let's see the common carotid arteries, okay? So the common carotid arteries, we're gonna talk about the right and left because they're the same in everything except the origin. We said the origin, we now know إنه for the left side, the left common carotid is directly from the arch of the aorta. For the right side, it's from the brachiocephalic trunk. Everything else is going to be the same. يعني the course is the same, termination, division حقتهم كل شيء is going to be the same ما عدا الorigin, okay? So this is exactly what I just said. The right, we said brachiocephalic artery, left arch of the aorta, tamam? And the course. Now let's see the course. Where do they go? First of all, we're talking about the common carotid, right? So the right and left, خلاص, I'm just going to say common carotid, لأنه they're the same in everything else. So for the common carotid, it's going to ascend upward inside the neck into the carotid sheath. Okay, it's going to go to the carotid sheath. تمام? What does it have medially and laterally? What's related to it? And here we have قلنا common carotid, right? Medially, what does it have? It has the trachea and the larynx. تمام? Laterally, what does it have laterally? It has a vein. This vein is known as the internal jugular vein. Internal jugular vein. We're going to talk about the vein in the end of the lecture, but for now, just remember إنه the common carotid artery, medially, it's associated with with the trachea and the larynx. And laterally, it's associated with the internal jugular vein. Okay? What about the termination? Where does it divide? Where does it terminate? خلاص? Where does the common carotid artery terminate? It terminates at the upper border of the thyroid cartilage. So exactly at which level? C3 to C4. So at C3, C4, which is the upper border of the thyroid cartilage, this is where the common carotid artery terminates. When it terminates, it gives us two branches, which are the external carotid artery and the internal carotid artery. Tamam? Now let's move on and see them in details. Okay? So first of all, let's start with the external carotid artery. The external carotid artery is going to be our main focus for the carotid arteries. The internal, we're not going to talk much about it. We're just going to say كده معلومات عامة عنه لأنه we're going to talk about it further on in the CNS block inshallah. Okay? So our main focus is going to be on the external carotid artery. تمام? Let's start with the origin. Where is the origin for the external carotid artery? We just mentioned that the termination for the common carotid is going to be when? It's going to be in the upper border of the thyroid cartilage between C3, C4. That means that's going to be the origin for the external and internal. معناها the external carotid artery والinternal carotid artery both have the same origin. Okay? Because they're both at the area where the common carotid terminates. So their origin is going to be the common carotid artery, of course, and huma their branches from it. And exactly where? And the upper border of the thyroid cartilage at C3, C4. Okay? كده we're done with the origin. It's the same. What about the termination? For the termination, or where does the external carotid artery divide or terminate? It divides in the parotoid gland. Where is this parotoid gland أصلا? What is it? The parotoid gland is this gland in green, okay? This is the salivary gland. خلاص, it releases saliva. تمام? So, الباروتويد gland هذه Right behind it, what can we see? We can see the neck of the mandible. Okay, so the neck of the mandible, خلاص, behind it is where the termination of the external carotid artery occurs. تمام؟ يعني هنا we can imagine إنه there's the parotid gland كده, behind it عندنا neck of the mandible, right behind that is the termination حق the external carotid artery. We can see it here. When it terminates, it gives us two branches. Okay, these two branches, we're gonna see them right now when we talk about the branches of the external carotid artery. Okay, so I'm gonna mention them here to avoid confusion. Now let's see the branches حق the external carotid artery. The branches are 8 branches. Okay, you need to know them very well. They're very important, especially in the OSPI كمان. The ones in green are the ones that the doctor said she'll probably like focus on for the OSPI. But for now, we need to know all of them. Okay, starting off with, first of all, the doctor gave us here a mnemonic. You can use it if you wish so, but I personally find it more easier to remember it in a story. Okay, so I'll show you the story, and you can use either ways you can remember it with, يعني either the mnemonic or the way I'll mention right now. So first of all, we have branches that are gonna branch anteriorly and branches which are gonna branch posteriorly. تمام? And we only have one كده exception which is gonna go upwards. يعني لا anterior ولا posterior. تمام? So let's see them in order. First of all, we said هنا this is the common carotid, right? So the common carotid قلنا عند the upper border of the thyroid cartilage and C3, C4, it's going to be the termination or the division. So when it terminates, it's going to give us the external. When internal, this is everything we just mentioned, صح? Internal, forget about it. We don't want to know it for now. We're going to focus on إيش? On the external. طيب أول branch حيطلع لنا من external carotid artery وين حيروح؟ حيروح عند الثايرويد gland, لأنه إحنا هنا قلنا أصلا termination occurs عند الثايرويد cartilage. So على طول جنبه حيكون إيش؟ الثايرويد gland. Okay, so first branch is going to go to the superior, it's going to be known as the superior thyroid artery, which is going to go to the superior part of the thyroid gland. Okay, كده we're done with the first branch. This branch is definitely anteriorly, لأنه الثايرويد gland is anteriorly, right? So this is going to be the first anterior branch. Then we're going to give a posterior branch. Where's the posterior branch going to go? It's going to go to the pharynx, okay? So the second branch is going to be the ascending pharyngeal artery. So كده عندنا branch anterior, which is the superior thyroid artery, and then another branch which is posterior, which is the ascending pharyngeal artery. تمام? Then احنا لسه قاعدين نطلع هنا, okay? We're going up, we're ascending, we go upwards. So as we move upward, we're going to reach the tongue, the mouth. Inside we have the tongue, right? So we're going to give a branch to the tongue. The tongue is going to be the lingual artery. So the third branch, which is going to be anterior, is going to be the lingual artery. Since we reached the mouth or the tongue, خلاص كده we're inside the face. So we're going to give the facial artery. So we have the lingual artery and the facial artery. تمام? Both of them are إيش? Anterior. تمام? Then we're going to continue upwards. As we move up again, where are we going to reach? We're going to reach the neck of the mandible. And if you remember, we mentioned here the neck of the mandible is the area where the termination for the external coracoid artery occurs, right? So we said it terminates into 2 branches. What are the 2 branches? The first branch, which is going to go anteriorly, is going to be known as the maxillary artery. So كده we're done with إيش? With all the anterior branches. The second branch is going to go upward. This is the exception. قلنا لا anterior ولا posterior. It's going to be known as إيش? Superficial temporal artery. So the termination of the external carotid artery is going to be where? It's going to be in the neck of the mandible, and it's going to give us 2 branches, which are the maxillary artery and the superficial temporal artery. تمام? تمام. And if you realized here, the superficial temporal artery is going to be right in front of the ear or the auricle, right? So we need to give a branch to the posterior side as well. هل معقول نعطي branch on the anterior ما نعطي in the posterior؟ لا, لازم نعطي in the posterior as well. So for the posterior part or posterior to the auricle or the ear, we're going to give a branch known as the posterior auricular artery. And then we're going to give the very last branch, which is also going to be posterior, which is the occipital artery. So quick revision. قلنا أول شيء هنا عندنا common carotid artery, right? The common carotid is going to divide into external and internal. We're going to forget about the internal. We're going to see the external. And external, the first branch it's going to give is going to be إيش? It's going to be to the thyroid gland. So it's going to be known as the superior thyroid artery. It's going to be anterior. Then it's going to give another branch, which is going to be posterior. It's going to go to the pharynx. So it's going to be known as the ascending pharyngeal artery. Ascending pharyngeal artery. تمام? Then we're going to move upwards. We're going to reach the mouth. So once we reach the mouth, we're going to give a branch to the tongue, which is known as the lingual artery. The lingual artery. Then we're gonna reach the face. خلاص, since we reach the mouth, we're in the face. So we're gonna give the facial artery. So we're gonna give the lingual and the facial arteries. Both of them are anterior. Okay? Then we're gonna move upwards زيادة بنوصل عند neck of the mandible. Once we reach the neck of the mandible, this is the termination or the area of termination for the external carotid artery. It's going to terminate into two branches. The first branch, which is the anterior branch, is known as the maxillary artery. The second branch, which is going to go upwards, يعني لا anterior ولا posterior, is known as superficial temporal artery. The superficial temporal artery, right behind it, we have the auricle, right? So we're going to give a branch posterior to the auricle or posterior to the ear, known as the posterior auricular artery. Posterior auricular artery. And then we're going to give the very last posterior branch, which is the occipital artery. تمام؟ كده we're done with the 8 branches of the external carotid artery. Now let's move to the internal carotid artery. For the internal, what do we need to know? It's very simple. We just need to know the origin. We said the origin is the same as the external. اللي هي ايش؟ حيكون ال common carotid artery and the thyroid cartilage C3 to C4. It's the same thing. And then it's gonna ascend through the carotid canal and reach the skull and enter into the cranial cavity. So it's gonna go into the cranial cavity, خلاص, and it's gonna supply it's gonna give branches to where? To the brain. Okay, so it's not gonna give any branches to the neck. This is a very important point. So an internal carotid artery only gives branches to the brain, and some branches go to the face. Okay, but in general, it doesn't give any branches to the neck. خلاص. So some of the examples of the areas where the internal carotid artery supplies are the brain, of course, and then the eyes, forehead, and part of the nose. Okay? We don't need to know them in details, as I said. We're going to mention them in the CNS block, inshallah. كده we're done with the carotid artery. Now let's move to the subclavian artery. For the subclavian artery, عندنا right and left subclavian artery, just like the carotid. يعني قلنا في الcarotid we have right and left carotid. وقلنا their origins are different. We mentioned no, the left is going to be directly from the arch of the aorta, while the right is going to be from the brachiocephalic trunk. Same thing here. The subclavian, the right is going to be from the brachiocephalic trunk, while left حيكون directly from the arch of the aorta. تمام? Everything else is going to be the same. As we said, يعني بس the origin is different. Everything else is the same. الcourse is going to be arched laterally in the root of the neck. And it's going to arch هنا, as we can see, this is the clavicle, صح? It's going to go right behind the clavicle. خلاص? Where does it go? It reaches in the first rib. Okay? Once it reaches the first rib, خلاص, it continues, its name is going to change. It's going to be known as the axillary artery. خلاص؟ يعني الأxillary artery الأوريجين حقه يعني هو في الأصل كان كان subclavian artery. Okay? So subclavian artery يطلع من وين؟ يطلع من on the left side يطلع من the arch of the aorta, on the right side يطلع من brachiocephalic trunk. بيروح كده عند the first rib. Once it reaches the upper border of the first rib, خلاص, its name changes. خلاص. What do we change its name to? We change it into axillary artery. تمام? Now let's see the branches of the subclavian artery. So when we say the subclavian artery, we need to remember a very important muscle known as the scalenus anterior muscle. So subclavian artery, على طول we remember the scalenus anterior muscle. Okay? Why is it important? Why is this muscle important? Because this muscle divides the parts of the subclavian artery. So we have 3 parts for the subclavian artery. The first part, the second part, and the third part. How can we differentiate between them? By this muscle. Okay? So here's the muscle. Okay? The scalenus anterior muscle. The part medial to it, or the medial part of the artery to the muscle, is known as the first part of the subclavian artery. The second part is right behind the muscle here. We can't see it. Okay, this is the second part of the subclavian artery. And the third part is here, is the part which is lateral to the muscle. تمام? Now let's see the division or what each part gives us. Okay, you can use this slide for revision because it has all of the parts. But let's see them from the original side so we can remember them and know them properly, and then you can come and revise them from here. Okay. So for the first part of the subclavian artery, let's remember إنه the first part, خلاص, since it's the first part, it's very important. So it's VIP. But instead of the P, we're going to put T. So VIT is for the first part of the subclavian artery. The first part is going to be VIP, which is VIT, actually, not P. خلاص? And we're going to see the divisions. First division is going to be V, which is the vertebral artery. Vertebral artery is going to go into the transverse foramen. If you remember the transverse foramen in the vertebrae, okay? So here we're gonna see the first division of the first part of the subclavian artery known as the vertebral artery. Second part or second branch is gonna be the eye, which is internal thoracic artery. This is gonna supply it's gonna supply the chest and the mammary glands. Okay, so the second branch is gonna be the internal thoracic artery. The third branch is gonna be the thyrocervical trunk. The thyrocervical trunk خلاص احنا تعبنا هنا وصلنا عند the third branch, right? So we're gonna tell it to sit down. Thyrocervical trunk, sit down, sit. Okay, once we say sit, that means it's gonna give us 3 branches. The first branch is the suprascapular artery. The suprascapular artery, which is here. خلاص. Then the second branch is gonna be eye, which is the inferior thyroid artery. If you remember, we talked about the superior thyroid artery where and branches of the external carotid artery. So here we said the first branch goes to the thyroid gland, صح? And we said it's known as the superior thyroid artery. So خلاص, this is going to supply the superior part. We need another artery to supply the inferior part. So who's going to give us that branch? It's going to be the first part of the subclavian artery, which is specifically from the thyrocervical trunk. It's going to give us the inferior thyroid artery, which is going to go supply the inferior part of the thyroid gland. And then the last branch is going to be the transverse cervical artery, which is going to go to the neck. Okay, it's going to supply the cervical area. Okay, so كده we're done with the first part of the subclavian artery. The branches we said are VIT, and then the thyrocervical trunk, which is the last part, which is T, is going to give us it's going to sit down. So it's going to give us 3 branches. تمام? These are for the first part of the subclavian artery. Now let's move to the second part of the subclavian artery. Second part, من اسمها, it's second, right? So it's going to give us 2 branches. So second part, 2 branches, okay? It's going to give us a main branch or a trunk known as the costocervical trunk. The costocervical trunk is going to give us 2 branches, which are superior intercostal artery and deep cervical artery. Superior intercostal artery and deep cervical artery. These are going to be from where? They're going to be from the second part of the subclavian artery. So second part هيعطينا the costocervical trunk, but then they're going to give us 2 branches, which are the superior intercostal and the deep cervical. تمام? Then we have the last part of the subclavian artery. The last part of the subclavian artery just gives us 1 branch, and sometimes it doesn't even give us the branch. Okay, what's the branch? It's the dorsal scapular artery. The dorsal scapular artery, in 66% of the people, it comes or it branches from the third part of the subclavian artery. What about the rest? In the remaining people, it branches from the second part. Okay, so only in 66% of the people, the dorsal scapular artery comes from where? It comes from the third part of the subclavian artery. تمام? كده we're done with all the arteries. Now let's move to the veins. For the veins, the most important thing we need to know for the veins are the formation and termination. So we need to know how each vein is formed, and when it terminates, what branches does it give, okay? And this is going to be the site of question. So focus on each vein and its formation, or how is it formed, and the termination, okay? This is very, very important. Now let's start. This slide is going to be a summary for all the coming slides. So we're going to start with it, and then we're going to go over the coming slides together, inshallah, okay? So first of all, we need to know for the arteries, obviously we started from the main artery, صح? We started from the arch of the aorta, and then we saw all the branches اللي طلعت منها and so on. For the veins, it's the opposite. We're going to see the small branches moving on to the main vein, okay, which is the superior vena cava. خلاص? So we're going to see how all these small branches and veins go back and drain into the main vein, which is the superior vena cava. Okay? So we're going to start from the opposite direction. تمام. The first 2 veins we're going to talk about are the same as the arteries that if we remember, in the termination of the external cricoid artery, we said it terminates into 2 branches, صح? And where did it terminate? It terminated عند الجلاند اللي هي الباروتid gland, اللي هي the salivary gland, right? So عند الجلاند, we said, which is at the neck of the mandible, خلاص? We said هنا حصل انقسام or termination of the external carotid artery, and it gave us maxillary artery and the superficial temporal artery. Now we're gonna see the opposite. We're gonna see the veins. So we're gonna see the maxillary vein and the superficial temporal vein. These 2 veins are gonna unite again. يعني هنا حصل لهم termination في الارتري. في veins, they're gonna come back and unite together. When they unite, where are they gonna unite? In the same site of termination, which is عند الباروتid gland. Okay, عند الباروتid gland. Okay. So عند الجلاند والneck of the mandible, that's where these two veins are gonna join or unite, and they're gonna give us one big vein which is known as the posterior facial vein. The posterior facial vein. So how is the posterior facial vein formed? It's formed by when the two veins unite اللي هما maxillary vein and the superficial temporal vein. يعني when the maxillary vein and superficial temporal vein unite together, this gives us the posterior facial vein. Where do they unite? They unite عند الparotid gland and the neck of the mandible. Okay. There's another name for the posterior facial vein, which is the retromandibular vein. Okay, but let's use the posterior facial vein. Okay, because it's the most commonly used one. But you have to know that this is the second name as well. طيب بعدين what happens as we move down خلاص, the posterior facial vein, we're still in the posterior facial vein, right? So the posterior facial vein here decides to divide. Once it divides, it gives us two branches, posterior division and anterior division. حلوين. Okay, what happens next? Let's go somewhere else. Let's go عند الeye. Okay, when we go to the eye, known as the orbit, right? So once we go to the eye site or this area, above it we have two veins known as supratrochlear vein and supraorbital vein. These two veins unite together as well. When they unite together, what happens? They give us the anterior facial vein. And how is the anterior facial vein formed? It's formed when the supratrochlear vein and the supraorbital vein unite together. تمام? So they unite هنا and they give us the anterior facial vein. Anterior facial vein تكمل in the face till it reaches where? It reaches a point where it meets it meets the anterior division of the posterior facial vein اللي قبل شوية قلناها صح. قلنا posterior facial vein divided into posterior division and anterior division. فهنا anterior facial vein توصل ل a point where it meets the anterior division of the posterior facial vein. What happens? They merge together. Once they merge together, they give us a main vein, which is a common facial vein. طيب, for the common facial vein, how is it formed? It's formed by when the two veins اللي هما anterior facial vein والanterior division of the posterior facial vein merge together. يعني لما anterior vein anterior يعني thin anterior vein anterior division of the posterior facial vein. When these two merge together, they give us the common facial vein. تمام. طيب, what about the posterior division? خلاص, we said the anterior division, it merges with the anterior facial vein and it gives us the common facial vein. What about the posterior division of the posterior facial vein? Remember in the arteries when we said behind the ear, behind the auricle, we had the posterior auricular artery. فأكيد we need to have a vein. The vein is going to be posterior auricular vein. So for the posterior auricular vein, it's going to come descending here. It's going to merge with with the posterior division حق posterior facial vein. فهنا نتذكر إنه posterior مع posterior anterior مع anterior. So anterior division of the posterior facial vein is going to merge with the anterior facial vein. Posterior division of the posterior facial vein is going to merge with the posterior auricular vein. Okay? When they merge together, what do they give us? They give us the external jugular vein. Okay, so the external jugular vein, how is it formed? It's formed when the posterior auricular vein merges with the posterior division of the posterior facial vein. Okay. كده احنا الحين وصلنا وين؟ وصلنا هنا to a point where we have a common facial vein, we have هنا an external jugular vein. طيب, معقول يكون في external jugular vein وما عندنا internal? We have to have an internal one, right? How are we going to see the internal jugular vein? The internal jugular vein is already here, okay? So the common facial vein is going to drain or going to go into the internal jugular vein. فكده common facial vein اللي هو أصلا أساسا كان من وين? What's the origin of the common facial vein? It's from the anterior facial vein and the anterior division of the posterior facial vein. خلاص? So the common facial vein is going to drain into the internal jugular vein. كده we have an external jugular vein and an internal jugular vein. طيب, the external and internal jugular veins are moving downwards till they reach where their final destination, which is the superior vena cava, right? So let's see how they're going to reach the superior vena cava. For the external jugular, it's going to move downwards till it reaches the subclavian vein. Okay, so the external jugular vein is going to reach the subclavian vein. Once it reaches the subclavian vein, it's gonna unite with another vein. Which vein is it gonna unite with? It's gonna unite with the internal jugular vein. So when the subclavian and the internal jugular unite together, they're gonna give us the brachiocephalic vein. Okay, so the subclavian vein and the internal jugular vein are gonna unite and give us the brachiocephalic vein. Okay. One thing we need to know here before we continue and reach the final destination, we're gonna remember إنه في الartery we had the arch of the aorta, right? And then we had the right brachiocephalic, and then here we had directly the arteries, right? أما في veins, it's gonna be different. في veins, we're gonna have two brachiocephalics. So we're gonna have the superior vena cava. The superior vena cava is gonna give us left brachiocephalic and right brachiocephalic. بعدين from the left and right brachiocephalic, we're gonna have the subclavian اللي هو the right subclavian وال left subclavian. And then we're gonna have the external jugular and internal jugular. So في veins, we're gonna have two brachiocephalic. We're gonna have right brachiocephalic and left brachiocephalic, and this structure is gonna be the same on both sides, يعني on the right and on the left. It's the same exactly. تمام. So once we reached هنا brachiocephalic, صح قلنا subclavian is gonna unite with the internal jugular and give us the brachiocephalic. So there's gonna be another brachiocephalic from the other side, right? So there's gonna be right brachiocephalic and left brachiocephalic. These two brachiocephalics are gonna unite together and give us our final destination, which is the superior vena cava. Okay. Now let's go over the slides and see them in more details. It's gonna be the exact same thing I just said, but in a different way. It's just gonna be worded in a different way, okay? But it's exactly the same thing we studied here. So if you remember this really well and you study this really well, you're not gonna need to go over these slides أصلا, okay? Let's start with the facial veins. قلنا أول شيء عندنا anterior facial vein. Okay, for the anterior facial vein, how is it formed? قلنا it's formed by the superior trochlear vein and the superior orbital vein. Okay, so the superior trochlear and superior orbital بيعطونا قلنا anterior facial vein. Termination, it unites with the anterior division of the posterior facial vein, also known as the retromandibular vein. Okay, and then what does it give us? It gives us the common facial vein. So this is the termination of the anterior facial vein. Okay. Next, we have the posterior facial vein. The posterior facial vein اللي هي هنا, we said how is it formed أصلا? It's formed by the maxillary vein and the superficial temporal vein. So when these two veins unite together, they're gonna give us the posterior facial vein. But where exactly do they unite? They unite عند الجلاند اللي هي salivary gland اللي قلنا اسمها parotid gland. Okay, so the maxillary and superficial temporal vein unite عند parotid gland and give us the posterior facial vein. حلوين. بعدين termination. Where's the termination? The termination is gonna have two terminations, and the posterior branch and the anterior branch. And قلنا أصلا it divides into two branches, right? So and the anterior. Let's start with the anterior. And the anterior branch, we just mentioned it a second ago, which is an anterior facial vein مع an anterior division. So it's gonna divide and it's gonna merge with it or unite with it and give us the common facial vein. This is the anterior branch. What about the posterior? The posterior is going to unite with the other posterior, اللي هي posterior auricular vein, and they're going to give us the external jugular vein. حلوين. بعدين what do we have? We have the common facial vein. Common facial is a repetition of what we just said. It's the same thing. What's the formation or what forms the common facial vein? It's formed by the anterior facial vein and the anterior division of the posterior facial vein. تمام, يعني when they join together or merge together, they're gonna give us a common facial vein. Termination terminates عند an internal jugular vein. Okay. بعدين here we have something new, which is the dangerous area of the face. What's the dangerous area, or where is it أصلا? Dangerous area is between the nose and the upper lip. طيب, so this area is known as the dangerous area of the face. Why is it named the dangerous area of the face? لأنه this area includes the deep facial vein. طيب, so ايش المشكلة طيب إذا فيها deep facial vein؟ deep facial vein هي it's directly connected to the veins or the sinuses inside the brain. So if any infection occurs in this area, it can easily reach the brain through the deep facial vein. تمام? So that's why it's a very dangerous area, لأنه in case of inflammation or in case of any infection that reaches the brain, it's gonna cause inflammation. تمام. But then here we have a diagram you can use for practicing to label. And then we have the external jugular and internal jugular. So for the external jugular and internal jugular, we have branches, okay? These branches, the doctor didn't focus on them a lot in the lecture, but let's just know them in case we need them, okay? but you don't really need to focus on them much, but just know them for information. The external jugular vein, أول شيء, how is it formed? We just mentioned it قبل شوي. External jugular vein is formed by the posterior division of the edge of the posterior facial vein and the posterior auricular vein. Okay, so this is the formation of the external jugular. The course, this is very important. Okay, this is a new information we didn't mention. This is very, very important. Okay, the course حق external jugular vein is, it's descending superficially to the sternomastoid muscle. So, if, for example, a question says, which of the following veins is superficial to the sternomastoid muscle? It's going to be the external jugular vein. Or the external jugular vein is superficial to which of the following muscles? It's going to be ايش? Sternomastoid muscle. تمام? So once you see sternomastoid muscle, خلاص على طول it's external jugular vein. طيب لأنه this is the muscle here and it's right in front of it. So that's why it's superficial descending in front of it. يعني it's descending in front of the sternomastoid muscle. تمام؟ تمام. بعدين عندنا termination of the external jugular vein. Termination, as we said, it's going to go where? To the subclavian vein. Okay? The divisions, it has 3 divisions. They're very easy. What are the divisions? The transverse cervical vein, the suprascapular, and the anterior jugular. Okay, these are the 3 divisions حقت the external jugular vein. Then we have an internal jugular. An internal jugular has something that's slightly different, which is ايش? Where does it begin? We never mentioned where the internal jugular begins here, صح? We just على طول we mentioned in the common carotid comes into the internal. But we never mentioned where did it come from. It comes from the brain. So it comes where exactly from the brain? From the sigmoid sinus. So an internal jugular في الأصل كان اسمها sigmoid sinus inside the brain. Once it leaves the brain خلاص and it goes downward, it descends, it changes its name into internal jugular vein. تمام؟ So نعرف إن the beginning of the internal jugular vein is the sigmoid sinus inside the brain. Okay? Okay. What about the termination? The termination, we said here, it joins مع الإيش؟ مع subclavian and they give us the brachiocephalic vein. Okay? Now let's see the divisions حقت the internal jugular. The divisions حقت the internal jugular are 5. They're very easy if we remember the arteries or the divisions of the external, here in the beginning, of the external carotid artery. If you remember here, we had 8 divisions, right? Here we only have 5 veins, okay? So the 5 veins are, some of them are named after the arteries here. So here we have pharyngeal vein, okay? Which we have here on the other side as pharyngeal artery. Here we have common facial vein. Here we have facial artery. Here we have lingual vein, lingual artery. Superior thyroid vein. Here we have superior thyroid artery. But then here we have a different vein which doesn't have an artery named after, which is the middle thyroid vein. حلوين حلوين. Okay? كده we're done with the internal jugular vein. Then we have the subclavian vein and the brachiocephalic vein. Let's go back to the vein diagram here. Okay? So we have a subclavian vein. Where does it begin? This is something برضو related to the arteries. If you remember, we said the subclavian artery. Here, when we're talking about the arteries here, so we said the subclavian artery goes all the way to the first strip. And once it reaches the first strip, it changes its name into it changes its name into axillary artery. صح? So here, it's the same thing, but opposite, vice versa. Okay? For the subclavian vein, it's going to be originally, it was the axillary vein. Once it reaches the first strip, it's going to change its name into subclavian vein. فعشان كده, the beginning of the subclavian vein is is axillary vein. Okay? Termination, where does it go? It goes to the internal jugular vein and they both join together or unite together and form the brachiocephalic vein. What about the branches it gives? It gives one single branch, which is the external jugular vein. The external jugular vein أصلا it's a branch from the subclavian. عشان كده في النهاية it ends up going back to the subclavian. Okay? Okay. Last thing we have is the brachiocephalic, which is a repetition of what we just said, which is the formation حقتها an internal jugular vein unites with the subclavian vein to give us the brachiocephalic vein. Okay? What about the termination? It terminates مع the other brachiocephalic, يعني 2 brachiocephalics اللي هو right brachiocephalic and left brachiocephalic. They terminate together ويعطونا يعطونا superior vena cava, which is our final destination. Here we have some questions the doctor mentioned and the case scenario.